Bismillahirrahmanirrahim. Assalamu alaikum dear viewers. I am Dr. Muhammad Usman, and in this video we are going to talk about Myasthenia gravis, then its pathophysiology, its signs and symptoms, how it is diagnosed and how we can treat it. Now basically myasthenia means myo and asthenia, muscle, myo means muscle and asthenia means weakness, and gravis means great. So in this way myasthenia gravis means great muscular weakness, and it is a disease of extreme weakness and fatigability. The fatigue characteristically improves on rest and worsens on activity. It can occur at any age, but its peak incidence is seen in 20s in females and in 60s in males. Now regarding the pathophysiology of myasthenia gravis, it is an autoimmune disorder, which means that in this disease autoantibodies are formed and they are against the acetylcholine receptor. Now such antibodies against the acetylcholine receptor, they are found in 90% of the patients, while there is another variety of myasthenia gravis in which there are only eye manifestations. This is called ocular myasthenia gravis. Now in these patients the autoantibodies are found in 50% of the patients. Now on the left side of this figure you are seeing a normal neuromuscular junction in which acetylcholine is released from the axon terminal and it acts on its receptors which are present on the sarcolemma. So in this way normal neuromuscular transmission takes place. But what happens in case of myasthenia gravis, that autoantibodies which are formed against these acetylcholine receptors, they block the receptors. Okay, they block the receptors, and now acetylcholine cannot bind with its receptors. These autoantibodies also destroy the acetylcholine receptor and cause their endocytosis, and in this way the number of acetylcholine receptors is decreased. These autoantibodies, they also destroy the subneural clefts, these are the subneural clefts and other structures of neuromuscular junction. In some patients autoantibodies are also formed against some other muscle proteins like ryanodine and titin and these repsin proteins, then these MUSK, which means muscle specific tyrosine kinase, and the autoantibodies have also been detected against these LRP4, which means low density lipoprotein receptor related protein 4. Okay, low density lipoprotein receptor related protein 4. So antibodies are formed and they have been detected against various structures of the this neuromuscular junction. Now what are the signs and symptoms of myasthenia gravis? First of all we will start with the ocular or eye manifestations, because as we have just discussed that some of the patients they only present with eye symptoms. The most common symptom regarding the eye manifestations is this ptosis. Ptosis means drooping of the upper eyelid. So this is the picture of the treatment before giving treatment for myasthenia gravis, and when we gave treatment to this patient, immediately the ptosis improved. Then another sign is seen which is called diplopia. Okay, diplopia means double vision. Then there is also weakness of extraocular muscles in certain patients. Regarding bulbar manifestations which are related to the brain stem, some patients have dysarthria. Okay, it means weakness of the muscles of speech. Then some patients present with dysphagia, which means difficulty in swallowing. Some complain of facial weakness and regurgitation of the food or liquids from the nose. Then there is truncal and limb weakness signs, and characteristically the proximal muscles. Okay, the proximal muscles they are affected more than the distal muscles. Similarly, arms are more affected in myasthenia gravis than legs. Patients with myasthenia gravis have a greater than normal tendency to have rheumatoid arthritis, SLE, which means systemic lupus erythematosus, and polymyositis. Now, myasthenia crisis. It means severe respiratory symptoms occur sometimes in myasthenia gravis patients, and this is called myasthenia crisis. It can lead to the death of the patient. It is precipitated by infections and by aspiration. Now, myasthenia gravis in pregnancy. Now, in pregnancy, disease worsens especially in the first trimester and improves later on, and then again worsens in the postpartum period. Antibodies are transferred from mother to the fetus, and newborn may have poor feeding and weakness for some duration until the antibodies are cleared. Now, regarding diagnosis, mostly it is clinical diagnosis is made, and the doctor can detect on the basis of history and signs and symptoms. But if we talk about the laboratory test, then tensilon test or edrophonium test is available, in which the edrophonium drug it is given, and it acts by blocking the acetylcholine esterase enzyme reversibly, and in this way it prolongs the action of acetylcholine. So, immediately the symptoms of patients are improved. The response is seen in 30 seconds to 1 minute. Then antibodies, especially the autoantibodies, can be detected against the acetylcholine receptors in the plasma by various techniques. Then MRI is available, and also other imaging techniques which may reveal thymoma and thymic hyperplasia, which is seen in many cases of this myasthenia gravis. Then EMG, and if we do the EMG of such patients, then muscle weakness will be revealed. Now, regarding treatment, we can give neostigmine. Okay, it decreases weakness in the disease and binds reversibly with the acetylcholine esterase enzyme, and we know that this enzyme is responsible for inactivating acetylcholine. So, when acetylcholine esterase is inactivated, then of course the available acetylcholine can act for longer periods. Then immunosuppression, which is done by corticosteroids and by azathioprine like drugs, and these destroy the antibodies. Then in certain patients, thymectomy, that is removal of thymus gland, it also improves the symptoms. Thank you for watching today's video. Please subscribe to this channel. Happy learning, stay blessed, and Allah Hafiz.